Well, good morning. I'm speaking today from the territory of Treaty 6, and I acknowledge that the Métis people share a deep connection with this land. I'm joined here today by Kathy Ward, whose family doctor served notice that he is moving out of the province, leaving her and his other patients without a family doctor in Wetaskiwin. Kathy is just one of hundreds of thousands of Albertans whose health care has been impacted by the decisions of the UCP. Now let's remember, just as the COVID-19 pandemic began, the UCP chose to pick a fight with doctors, family doctors in particular, causing many to leave the province. Their mismanagement throughout the pandemic has led in good part to the healthcare crisis that so many Albertans are experiencing today. They set a tone of disrespect, and now the results of their callous arrogance are clear. Today, hundreds of thousands of Albertans are without a family doctor. Dozens of rural hospitals are partially closed. Urban emergency rooms are overwhelmed, and ambulances are being delayed longer and longer. The UCP's recent announcement of $1 million to, quote, explore ways that regional post-secondary institutions can help deliver medical education outside of Edmonton and Calgary, quote, is typical of a government that acts too late and offers too little. At best, graduates from these potential programs are many years away. We have a severe staffing crisis in this province right now, and Albertans deserve and expect positive action to attract and keep healthcare workers here, not more chaos and uncertainty. I would now like to turn things over to Kathy to share her story.
Thank you, David. I'm here today because I was shocked and upset to receive a letter in the mail a couple of weeks ago. Our family doctor sent us a note to say he was leaving Alberta, and after April 7th, he would no longer be able to provide medical care. He cited his main reason for leaving is, quote, the unstable political climate within the Alberta government and Alberta Health. Between unilaterally ending agreements with physicians to replacing the entire Health Authority Board, this is a large reason that so many physicians choose to leave, end quote. When my husband and I moved from the Maritimes to Alberta in 2020, our main criteria when buying a home was that the city or town we moved to must have a hospital and access to a family doctor. Our house in Wetaskiwin is within walking distance of the clinic where we found a family doctor 5 days after arriving. And although it would be a bit of a hike, we could walk to the hospital if we had to. And there's a fire hall down the street. It's all very convenient. All those things that young people don't think, but as you get older, they become important considerations. We need a family doctor, and you want a hospital close by. It meant everything to us to have those services near us. I'm going to be 69, and my husband is 68. We are getting older. Things start to happen. We want a family doctor who knows you, someone who knows your medical history, someone you can talk to. That familiarity is very important. The letter from our doctor included a list of options for finding a new family doctor. My husband looked into them all. There are no doctors in Wetaskiwin taking on new patients, and the nearest one we could find was in Camrose. We live in Wetaskiwin. I don't want to have to drive 40 kilometers down the highway to see my family doctor. And I certainly don't want to move to Camrose so we can be close to a family doctor. We can continue to use the medical clinic near our home on a walk-in basis. So, if we need a doctor, we will have to phone at 8:30 in the morning, and if they are not full for the day, we should be able to get an appointment. If not, we have to try again the next day, 8:30, and so on and so on. We're seniors, and we're at an age that when we need to see a doctor, I want to see a doctor now. I don't want to wait weeks, days, any time to see someone who doesn't know me, and certainly I don't want to get in my car and drive to Camrose. For now, we can still get our prescriptions filled, and I guess we'll still have to try calling at 8:30 and try to get in, but it's not anywhere near the same as having a family doctor. I don't really think a lot of seniors know what damage Danielle Smith is doing to the healthcare in Alberta. And healthcare professionals around the world will hear the dangerous anti-science I turned too far. Sorry. For one thing, I'm sure we are not the only seniors who have gotten a note saying their doctor is leaving. Our doctor's letter suggests he's not the only one getting out of Alberta. It's scary. We as seniors didn't sign up for this uncertainty, lies, and chaos. I'm just hoping everybody realizes what damage Danielle Smith and the UCP have caused already and are ready to make their voices heard at election time so we can stop this madness.
Well, thank you, Kathy, for sharing your story with us. Unfortunately, we've heard about many doctors and other healthcare workers who are leaving Alberta to escape the hostility of this UCP government, and we continue to hear from folks like Kathy who are losing a family physician. Just last week, we saw former UCP Health Minister Tyler Shanto face a disciplinary hearing related to his unacceptable conduct towards doctors. And healthcare professionals around the world will hear the dangerous anti-science rhetoric of Danielle Smith and will look elsewhere to build their careers. The UCP can't be trusted to fix healthcare. Danielle Smith is already on record saying that she would consider Albertans paying out of pocket for their family doctor. And she wants to dismantle public health care to pave the way for more privatization. Albertans deserve better. Seniors deserve better. Rachel Notley and the Alberta NDP will end the UCP chaos in healthcare and will make sure Albertans see a doctor faster and in their community. We will launch the largest healthcare recruitment campaign Alberta has ever seen, and we will make sure Alberta families have access to the care they need when they need it, close to home. We will put an end to the UCP's failed experiments in privatization and repair publicly funded, publicly delivered healthcare. We will bring real resources to the front line. We will work collaboratively, respectfully with healthcare professionals. And together we will bring doctors back to this province. That's what Albertans like Kathy deserve. Thank you, and we're happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start with questions in the room.
Catherine Gurkowski, Alberta Today. There were a couple of reports that came out today. One of them was by the Canadian Federation of Independent Businesses, and they suggest that 6.5 million visits in Alberta could be freed up if there's less red tape, if doctors are doing less administrative work. Is that a concern that you have heard from doctors? Is that something you'd be willing to look at to expand capacity of doctors?
So absolutely, I have heard from doctors about the amount of paperwork, administrative work that they need to do. In fact, doctors talk about that quite a bit, that at the end of the day, when they are done seeing patients, they still have hours of paperwork they need to go through, and they do that on their own time, from home and on the weekends. So we recognize it's challenging. You know, it makes me think back. Again, I was talking about 2020 and the UCP going on the attack, launching its war against doctors. They forced through a new funding physician framework on April 1st of 2020. Right when doctors were dealing with the first wave of a pandemic, they had to suddenly learn a whole bunch of new billing codes. They had to make all kinds of changes in their practice. The UCP forced that through. So this is a government that has made that burden substantially worse for doctors at every turn. What I would say is certainly there are things I think the government can do to help address that, and Alberta NDP government absolutely would. There are ways that we can support clinics, we can support doctors to work in teams and with other professionals that reduces that administrative burden and makes it easier for them to be able to spend more of their time working with patients. We'll have more to say on that in weeks to come.
And there's another report as well. It was from secondstreet.org, and it's calling not for American style, but for more European model. Are there any lessons from what Europe does in healthcare that you would be interested in exploring, or is it totally all public all the time? What do you see as the answer?
I think fundamentally what we need to do, first of all, is get the basics right. And right here in Alberta, we have a government that has been unable to do even that. They came in, they tore up the system, they tore it up by their roots, they disrupted it, they attacked healthcare workers to try to impose some of their new ideas, and what they've created is chaos, uncertainty, and a mess. We need stability back in our healthcare system. We need to work with our frontline healthcare workers, family physicians in particular, to undo the damage that the UCP has caused. And then we start looking forward and we look at ways that we can innovate and move forward. And those, I believe, exist within the public system. We have the opportunity to find better ways to operate clinics, to support physicians, to explore ways that we can pay physicians in a way that incents them and enables them to be able to spend more time with patients and address complex issues. So that is where an Alberta NDP government will begin. We will invest in the public system to end the chaos, build stability, and work collaboratively with our frontline healthcare workers to build innovation that allows them to provide better care.
Thank you. We'll go to questions on the line now. Just state your name and outlet, please, and who you'd like to ask your question of.
Tyson Fedor with CTV in Calgary. This would be for David, and a little off topic here, but as we get closer to the election here, about 3 months out, we're starting to see some polls come out as well, and it's a tight horse race in a sense between the NDP and the UCP heading into that election. But what do you see as some of the big things that need to maybe make up ground? UCP having slight leads in some of these polls, not very much in this province, but what is it that the NDP needs to do to become government come May?
I think Albertans have been clear about what they're looking for. They're looking for a government that is going to provide stable, competent leadership. They're looking for a government that is going to address the chaos in the healthcare system. They're looking for a government that is going to address the pressing issues of affordability that are impacting so many Albertans. And we have credible plans to do just that. We have our track record of 4 years in government where we brought stability back to the healthcare system after years of chaos and uncertainty caused by the roller coaster of funding under previous Conservative governments. They're fighting with healthcare workers, the constant churn in the health minister's office. We will bring stability back. And we know that Albertans trust us on that. We're going to continue to bring forward our plans and our message on that. We have put clear plans on how we would bring affordability measures to all Albertans. This is a government that has undermined affordability from Albertans since day one, removing the cap on utility rates, removing the cap on insurance, causing those rates to skyrocket, and now coming in at the last minute trying to put in a few fixes just before the election. I think Albertans remember. And so we're going to continue to do that work on the ground, go door to door, talk to Albertans every day, continue to bring our message forward of how we're going to work together with Albertans to address the issues that are important to them.
Do you have a follow-up, Tyson?
Yeah, just a quick follow-up. We know that Edmonton, of course, is a very big stronghold for the NDP, and Calgary's kind of been a bit of a battleground. It will be a battleground this election. What is the NDP looking at to try to gain some ground in the Calgary region to potentially flip some of these seats?
So our focus has been, first of all, on nominating some amazing candidates, folks with incredible experience, background, credibility on a number of fronts. We have certainly teachers. We have folks that are working on the front lines of the healthcare system, folks who have deep expertise within the healthcare system. We have folks with deep expertise in energy, renewable energy, and folks that have worked on building the economy. So we're proud of the team that we've had, and we know all those folks are out there every day, knocking on doors, talking to Calgarians, because that is where this will be decided. I appreciate the work that's done in polls. I appreciate the comments from the punditry, but ultimately this is about us talking to Albertans, and it's going to be who can speak to them and bring the clearest message about how they're going to move Alberta forward, and I am confident in our work on that.
Thank you. We'll just do one more. Oh, there's Madeline. Your line is open. Okay, Madeline, your line should be open now.
Oh, there we go. You hear me now?
Yes, absolutely.
Okay. Can you just tell me specifically what the NDP would propose to do to increase the number of family doctors? I know there's a lot of talk about broad things like stability and whatnot, but are there specific measures, at the local level to incentivize more family doctors to come here or to keep their clinics open longer? Like, what actions would you like to see?
So as I said, I understand what you're saying, sort of about talking generally about things like stability and collaboration, but let's be clear, those have been two of the biggest things for physicians in the last few years. Indeed, this doctor right here, who is leaving Wetaskiwin, the first point he made on why he is leaving, the unstable political climate within the Alberta government and Alberta Health. Between unilaterally ending agreements with physicians to replacing the entire Health Authority Board, it's a large reason many physicians choose to leave. So that is a fundamental issue. And I think it is an important one that we emphasize that we are going to work collaboratively with and support doctors, as we did when we negotiated with them during our time in government. Now, of course, there are some specific actions that can be taken. As I said, we are going to have more to say on some of our specific primary care policy in weeks to come. But I think there's a lot of discussion out right now. It's not hard to find folks who are talking about the work that needs to happen in primary care, that looking at where we are supporting and incenting teams of folks to be able to work on those front lines. We need to be looking at how we can better incorporate a lot of the different kinds of skill sets and training that we have available within the healthcare system to support family doctors, how government can encourage and help that to occur. And we'll have more to say on that in weeks to come.
Do you have a follow-up, Madeline?
Yeah. The other thing is that, Alberta, according to sort of the most recent numbers, Alberta gained about 250 doctors in 2022. So what is your kind of response to that? Because I think the government might say, well, we're already making progress on this and attracting more physicians. So what more needs to be done, and is that number good enough?
So to be clear, what you're talking about there are registrations. So a doctor can be registered and not practicing. A doctor can be registered and perhaps working 1 or 2 days a week. So it is difficult from those numbers to say what actual impact that will have or has had on the ground. But what I can say is we still have folks like Kathy who are coming forward and saying, I am losing my family doctor and I cannot find another one. We still have situations like we have in Red Deer where we are still not fully utilizing our public operating rooms there because we are still short on anesthesiologists. And we know this is true across the province. We still face a critical staffing shortage. We go out, we talk to Albertans, we look at the reality on the ground. It is not the rosy picture that this government wants to claim when it says help is on the way, or in this case, claim it's already arrived. So the fact is the government can play shell games and they can talk about numbers and statistics, but we are going by the reality on the ground, what we are hearing from healthcare workers and what we are hearing from Albertans. And what we are hearing is that we need a new government in Alberta to bring stability back to our healthcare system, to rebuild trust with healthcare professionals that have been under attack by this government for multiple years. And that's what we're going to offer with the Alberta NDP.
Yeah, I have another round. this one for Kathy, if I may. When you moved here to Alberta in 2020, what was it that drew you? What was your hope in coming to Alberta?
We are originally from BC, and what we had done is my husband's from Ireland, so we retired and we went to Ireland to visit family. And we sold up before we went, closed our business. And when we were in Ireland, we decided, no, my husband wanted to come back to Canada. So we knew we couldn't go back to BC. So we ended up in Nova Scotia for 3 years, but we're Westerners. So we came back here to Alberta. My mother actually is originally from the prairies. They homesteaded in Rumsey, so we're Albertans. We just wanted to come home.
And can you You mentioned it was a couple of weeks ago you got that letter from your doctor. What went through your mind as you were reading this?
Well, the first thing I did was cry because, like I say, we're at an age where we're getting older. My husband is a kidney stone producer, has already had, actually, when we arrived here, kidney surgery in Red Deer, emergency surgery, and you know, has been told there's another couple there, we could have a problem, and now we don't have a doctor. So we hope and pray every time he gets a pain in his side, he has a fit, and we just hope and pray that he's okay until such time as we maybe do find a doctor. But I'm not moving. I love Wetaskiwin. You know, we bought our house over online, you know. We didn't even know what we were coming to, drove across the country and came here, and we've been very happy here since. I don't want to move because I don't have a doctor anymore. So it's very unsettling, very unsettling.
Thank you. We'll just do one more pass for questions. Reminder for Zoom, it's the raise hand. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.